The phenomenon of gynecomastia, or male breast enlargement, often raises many questions. Is this swelling a serious health problem? Can it develop into tumors? What are the main causes behind it? And what symptoms should a person look for? We'll also talk about the essential tests that help diagnose this condition, because not all cases are the same. Some are due to hormonal changes. Others result from medications, obesity, or certain diseases. We'll go through the different types and discuss the best treatment options available today. You'll also learn about the foods that can either worsen or help reduce the condition, and whether specific exercises can really make a difference. So, if you've ever wondered how to deal with this issue safely and effectively, stay with me and let's explore everything about gynecomastia step by step. Peace be upon you. I'm Hussein Lotfi, and you're watching Octopus Pharmacist in a new episode of From A to Z. Welcome, my friends. Before we begin, if you'd like to know the title of today's episode, just play the video for 1 minute. You'll see it appear clearly. But if you want to understand everything about gynecomastia, its causes, symptoms, and treatments, then stay with me from the beginning to the end of this video. As usual, let's start by setting a clear foundation. First, what is gynecomastia, scientifically speaking? In medical books, gynecomastia is defined as a benign, non-cancerous enlargement of male breast tissue. In simple terms, this means that the glandular tissue in the male breast becomes larger than normal, and in most cases, it's not dangerous. Now, the second point, what causes this enlargement? The main reason is a hormonal imbalance between testosterone, the male hormone, and estrogen, the female hormone. Normally, estrogen exists in men too, but in very small amounts. When this concentration rises or testosterone decreases, the balance shifts. That's when estrogen starts stimulating the breast tissue, causing the swelling and tenderness we see in gynecomastia. Let's move to the third point, and it's quite interesting. You might ask, if estrogen is a female hormone, then what's its role in men? Actually, it has many important functions. A small portion of testosterone is naturally converted into estrogen in the male body, mainly through the adrenal glands, fat tissue, and even the testes. Despite being in low levels, estrogen plays a big role in bone strength and density, heart health, memory, attention and concentration, sexual health and libido, fat distribution throughout the body, and even the health of the skin and bladder. So, a little estrogen is necessary, but too much can cause trouble. Now, let's look at normal hormone levels in the blood. For women, estrogen levels range between 30 and 400 picograms per milliliter, depending on the day of their menstrual cycle. But for men, levels usually stay stable, between 10 and 50 picograms per milliliter. As for testosterone, the normal male range is between 300 and 1,000 nanograms per milliliter. Only about 1 to 2% of that testosterone is converted into estrogen, and that's considered normal. The healthy balance between estrogen and testosterone is around 0.005, but when estrogen rises, and this ratio reaches 0, 0.1, or higher, that's when gynecomastia can start to appear. At this stage, estrogen begins to activate the breast cells, causing them to multiply and enlarge. In extremely rare cases, prolonged hormonal imbalance can cause abnormal cell growth, which is why every man with breast enlargement should be checked by a doctor. This helps rule out any serious or tumor-related causes, even though they're uncommon. Now, an important point that's often overlooked. Gynecomastia doesn't just affect the body. It affects the mind and emotions too. Many men with this condition feel embarrassed, anxious, or lose self-confidence, especially because of how others might look at them. So please, if you know someone struggling with it, treat them kindly. Don't judge or make jokes. It's a medical condition, and it can be treated. Finally, remember this. Gynecomastia can also cause pain or discomfort, especially during movement, exercise, or physical work. So, It's not only a cosmetic concern, it's a real physical issue that deserves proper care. Stay with me, because in the next part, we'll talk about the types of gynecomastia, the medical tests you should do, the main treatment options, and even the foods and exercises that can make a real difference. Let's continue together, step by step. Now, let's move to a very important part. What are the main causes of gynecomastia, or the enlargement of male breast tissue? In fact, there are 7 major causes behind this condition. Let's go through them one by one, clearly and simply. First cause, medications. This is actually the most common reason. There's a long list of medications that can interfere with male hormones, either by lowering testosterone or increasing estrogen levels in men. Examples include anti-androgen drugs, which are often used to treat prostate cancer, spironolactone, a diuretic that can block male hormones, some antibiotics like metronidazole, antifungal drugs such as ketoconazole, antipsychotic and antidepressant medications, which can affect hormone balance, anti-ulcer drugs like cimetidine, and even certain HIV medications, which may disturb the hormonal ratio. All of these can increase estrogen activity or reduce testosterone, leading to a gradual swelling of the breast tissue. Second cause, hormonal imbalance. In some men, the body simply doesn't produce enough testosterone. This can happen due to testicular underdevelopment, injury, or genetic factors. When testosterone levels drop, the body's natural balance shifts. A portion of what little testosterone is produced gets converted into estrogen, and the ratio between the two hormones changes, causing breast tissue to grow and gynecomastia to appear. Third cause, substance abuse. Addiction plays a big role too. Frequent use of alcohol, marijuana, amphetamines, or heroin can seriously affect hormone production. These substances damage the liver and the glands that regulate hormones, which eventually causes testosterone to fall and estrogen to rise. Fourth cause, aging. As men grow older, testosterone levels naturally decrease. However, the body continues to convert testosterone into estrogen at the same rate. This means the balance tips in favor of estrogen. So even with normal estrogen levels, the ratio becomes higher, and gynecomastia may develop. That's why this condition is quite common in older men. Fifth cause, puberty, adolescence. This one happens in teenage boys. During puberty, hormone levels fluctuate dramatically. The ratio between testosterone and estrogen isn't yet stable, and this temporary imbalance can cause mild breast enlargement. The good news is that this form is completely normal and temporary. Once the hormones stabilize, usually within a year or 2, the chest returns to normal without any treatment. Sixth cause, certain diseases. Some medical conditions can also lead to gynecomastia. One of the most well-known is hyperthyroidism, where the thyroid gland becomes overactive and produces too much thyroxine T4. When T4 levels are high, the metabolism speeds up, and one of its side effects is that it increases the breakdown of testosterone in the liver. This lowers testosterone levels and raises the estrogen to testosterone ratio. Liver diseases can have a similar effect, since the liver is responsible for breaking down hormones. When it's not functioning well, estrogen stays longer in the body, again leading to hormone imbalance and breast enlargement. Seventh cause, obesity and poor nutrition. This is one of the most common causes in modern times. When a person gains excess weight, fat cells begin to accumulate. These fat cells contain an enzyme called aromatase, which converts testosterone into estrogen. So, the more body fat a person has, the more testosterone gets turned into estrogen. Over time, this imbalance causes gynecomastia and also contributes to other metabolic problems. That's why maintaining a healthy weight and balanced nutrition isn't just good for appearance, it's essential for hormonal health too. Before we end this section, it's worth mentioning something you might see in medical books. Gynecomastia is often classified into 3 main types: Physiological, natural and temporary, like during puberty or aging. Pathological, caused by diseases or medications. Idiopathic, when the cause isn't clearly known. But for us here, what really matters are the main practical causes we just discussed. Because these 7 reasons cover nearly all cases of gynecomastia in men. So, now that we understand why gynecomastia happens, in the next part, we'll go through the diagnostic tests, treatment steps, and lifestyle changes that can truly make a difference. Stay tuned, and let's continue our journey from A to Z together. Now, let's move to the third part of our episode. What are the symptoms that a person with gynecomastia usually complains about? What are the medical tests the doctor requests? And what do the results of these tests usually show? Let's go step by step. First, the symptoms. Gynecomastia generally causes 3 main symptoms. 1. Swelling in the chest. The first and most obvious sign is an unusual enlargement of the chest. You might notice that the chest looks rounder or more prominent than usual, sometimes on one side only, and sometimes on both sides. This swelling is typically under the nipple area, and it feels like a rubbery or firm mass beneath the skin. 2. Pain or tenderness. The second symptom is pain or sensitivity in the breast tissue. Many patients describe it as a sharp or stabbing pain, sometimes accompanied by a burning or tingling sensation. Even light contact, like touching the chest, walking, or rubbing against clothing, can trigger discomfort. This pain may come and go, or stay for a while and then fade on its own. 3. Nipple discharge or visible changes. The third and most important symptom is the appearance of nipple discharge or visible lumps. This doesn't always happen, but when it does, it's a warning sign that requires immediate medical attention. The fluid may appear clear, milky, yellowish, or even bloody. Each color may point to a different cause, and only a doctor can determine the reason through proper testing. If you ever notice such discharge or an unusual lump, do not ignore it. Visit your doctor as soon as possible. Second, the required medical tests. To understand what's really happening, the doctor must identify the underlying cause. The first step is to measure hormone levels in the blood. 1. Hormone tests. The doctor checks testosterone and estrogen levels and then calculates the ratio between them. This helps determine whether the enlargement is due to gynecomastia or another hormonal disorder. 2. Pituitary hormones, LH and FSH. These 2 hormones are secreted from the pituitary gland in the brain, and they control how much testosterone your body produces. If they're too high or too low, it can explain why testosterone levels dropped. 3. Prolactin level. The doctor may also measure prolactin, the milk hormone. If prolactin is elevated, it can sometimes cause breast swelling and discharge in men. 4. Thyroid function tests. These include TSH, T3, and T4. They help detect hyperthyroidism, an overactive thyroid gland, which speeds up metabolism and increases the breakdown of testosterone. As testosterone decreases, estrogen becomes dominant, leading to gynecomastia. Once the thyroid condition is treated, the breast swelling often improves on its own. 5. Liver and kidney function tests. The doctor will also check liver enzymes and kidney function. This is important because both organs play a role in breaking down hormones and medications. If the liver or kidneys aren't working properly, estrogen can accumulate in the body and disturb the hormone balance. 3. Imaging and tumor evaluation. If the lab results suggest something unusual, the doctor may look for tumors or abnormal tissue changes. To do this, they may order an ultrasound or mammogram, which helps visualize the structure of the breast tissue. Imaging can show whether there's an increase in glandular tissue density, the number of milk ducts has grown, there are any fluid-filled cysts or solid masses, or, in rare cases, any tumor-like changes. If a suspicious lump is found, the doctor will take a small biopsy sample from the area to confirm whether the cells are benign or cancerous. It's important to note that male breast cancer is rare, but Doctors always check to rule it out because early detection makes a huge difference in treatment and recovery. In summary, gynecomastia symptoms range from mild swelling and pain to more serious signs like discharge or lumps. Doctors rely on hormone tests, organ function tests, and imaging to understand the cause and confirm whether it's a simple hormonal imbalance or something that needs further medical care. So, if you ever notice any of these symptoms, don't panic, but don't ignore them either. Seek proper evaluation early, and you'll likely get clear answers and an effective plan for treatment. Stay tuned. In the next part, we'll talk about how gynecomastia is treated step by step. Now we've reached the fourth and final point for today. The treatment steps for gynecomastia, also known as male breast enlargement. In fact, we have 5 main treatment approaches. Some are medical, while others are surgical. Let's go through them step by step, and I'll explain how each one works and when it's used. Step 1. Selective estrogen receptor modulators, SERMs. These are usually the first-line medical treatment. The term modulator means that these drugs can act differently in various parts of the body. Sometimes they mimic estrogen, and other times they block its effects. In gynecomastia, we want to block estrogen activity in the breast tissue. The 2 most common options are tamoxifen 20 milligrams once daily or raloxifene 60 milligrams once daily. Treatment typically continues for 3 to 6 months. This group works in 2 important ways. 1, it blocks estrogen receptors in the breast tissue, reducing estrogen stimulation. 2, it triggers apoptosis, a natural process that helps break down and shrink the enlarged breast cells. Over time, this causes a gradual reduction in breast size. If there's no improvement after about 6 months, the doctor may move to the next treatment step, which can involve surgical options. Step 2, aromatase enzyme inhibitors. Now, what is aromatase? It's an enzyme found mainly in fat tissue that converts male hormones, androgens, into estrogen. That's one reason obesity can worsen gynecomastia. So, this treatment works by blocking the aromatase enzyme and therefore reducing estrogen production in the body. The 2 main medications are anastrozole 1 milligram daily or letrozole 2.5 milligrams daily. These are also used for 3 to 6 months and are especially useful in cases related to hormonal imbalance or obesity. Step 3, testosterone replacement therapy. Here, the doctor gives testosterone from outside the body, but only if blood tests show low natural testosterone levels. This is often seen in hypogonadism, a condition where the testicles are small or underactive, producing less hormone than normal. Giving external testosterone helps restore hormonal balance, but it must be done very carefully. Why? Because too much testosterone can have the opposite effect. It can shut down natural hormone production, cause infertility, and in rare cases, increase the risk of prostate problems or cancer. That's why regular blood monitoring is essential. There are several testosterone forms available. Skin patches, 2.5 to 5 milligrams daily. Topical gels or creams, 1 packet, 2.5 to 5 milligrams daily. Injections, 50 to 100 milligrams every 2 weeks, or 200 milligrams monthly. Implants under the skin, 200 to 600 milligrams lasting 3 to 6 months. The doctor chooses a method based on the patient's age, cause, and response. Step 4, gonadotropin-releasing hormone, GnRH, analogs. This group acts on the brain's hormonal centers, specifically controlling the release of LH and FSH, which are responsible for regulating both estrogen and testosterone production. At first, these analogs stimulate hormone release, but after about 2 weeks, they actually suppress it completely. So, they are not a standard treatment for typical gynecomastia. They're used only in specific cases, such as hormonal imbalance due to aging or certain medical conditions, where it's necessary to temporarily suppress both estrogen and testosterone to rebalance the system. 2 common options are leuprolide, given as a subcutaneous injection, 50 to 150 G/kg monthly. Gozerlin, available as an implant, either 3.6 milligrams monthly or 10.8 milligrams every 12 weeks. But again, these are rarely used except in severe, hormone-driven cases. Step 5, surgical treatment. Finally, if medical treatments fail or if the breast tissue is large and fibrotic, surgery becomes a definitive solution. There are two main surgical options. 1. Subcutaneous mastectomy. A small incision is made around the areola, the darker area around the nipple, and the glandular tissue and excess fat are removed directly. 2. Liposuction. A less invasive method that removes only the fatty tissue, usually for mild or moderate cases. Sometimes both techniques are combined for the best cosmetic result. The recovery is usually quick, and the results are long-lasting, especially if the underlying cause is treated and hormonal balance is maintained. So, to summarize, the treatment of gynecomastia follows a logical sequence. Start with medical options like SERMs or aromatase inhibitors. Correct any hormonal imbalance if needed, and if all else fails, move on to surgery. Each case is unique, and treatment must always be personalized, based on age, cause, hormone levels, and overall health. In the next part, we'll talk about food, supplements, and exercises that can either help improve or worsen gynecomastia, and how to naturally support your recovery and hormone balance. Stay tuned. Now we've reached the fifth and final topic for today. What exercises and foods can help prevent or reduce gynecomastia in men? Let's start with exercise. There are many types of physical activity that can help reduce body fat. And since excess fat increases estrogen levels, exercise is one of the best natural ways to manage gynecomastia. Running, swimming, cycling, basketball, tennis, and weight training are all excellent choices. But if you want something simple that you can do at home, you only need 10 to 15 minutes a day of focused effort. That's where HIIT, or high-intensity interval training, comes in. It's one of the most effective and time-saving workouts for burning fat and balancing hormones. There are many easy HIIT routines online. I'll leave some helpful links in the description below this video. And remember, no exercise works alone. To get real results, you need to eat well, drink enough water, and get proper sleep. These three basics keep your hormones balanced and your metabolism active. When your body stores too much fat, it naturally starts to convert more testosterone into estrogen, which can worsen the condition. Now let's talk about food and what you should avoid or focus on to keep your hormones healthy. First, the foods that can increase estrogen and worsen gynecomastia. 1. High sugar foods and drinks. Here's why. When sugar levels rise, your body releases insulin to move glucose into your cells. If the sugar remains high, insulin starts storing it, first as glycogen in the muscles and liver, and then as fat in the abdomen and chest. More fat means more aromatase activity, which turns male hormones into estrogen. 2. Unhealthy fats, especially from fried and processed foods, such as fast food, chips, and pastries. These promote inflammation and fat storage, both of which worsen hormonal imbalance. 3. Foods rich in plant estrogen or phytoestrogens. These include soy products, flax seeds, and some herbal supplements. While small amounts are harmless, regular large doses can increase estrogen activity in men. Now, for the healthy side, let's look at foods that support testosterone and help reduce estrogen naturally. 1. Leafy green vegetables, rich in vitamins and antioxidants. 2. Fatty fish, such as salmon or sardines, which are high in omega-3. 3. Nuts and seeds, especially walnuts and almonds. 4. Whole grains, which provide healthy fiber for stable blood sugar. 5. Beans and legumes, great sources of protein and minerals. 6. Fresh fruits, especially those high in vitamin C and zinc. 7. Lean meats, like skinless chicken or turkey, which provide protein without extra fat. 8. And for cooking or dressing, choose healthy fats such as olive oil, avocado, or nuts. Finally, let's mention a few key supplements that can help regulate hormones. Zinc, which supports testosterone production. Vitamin D, essential for hormone balance. Omega-3 fatty acids, which reduce inflammation and support healthy metabolism. These three are among the most important nutrients to keep your hormone levels stable and natural. And that wraps up today's topic. I hope this video helped you understand how exercise, diet, and lifestyle can all play a major role in preventing or improving gynecomastia. If you found the information helpful, please like, share, and subscribe to the channel. And don't forget, you can support the channel on Patreon, PayPal, or YouTube. Stay healthy, take care of your body, and see you in the next video. Hussein Lutfi.